H5N1 and H1N1 have, let's say, completely different epidemiology, but they can attack cats, and that's why we are concerned in ABCD with these cat infections. And I must say that, of course, we were concerned in Europe only with sporadic cases of influenza infection in cats, but these are points of concern and we have to deal with. As there are sporadic cases and we discover these cases in cats, there are no vaccines that are available yet, of course, because there is no sense to develop specific vaccines for cats. We have faced sporadic cases of this avian influenza infection in cats, and it was in 2006, and also, let's say, during the pandemics, kinds of what we can say retrozoonosis, the fact that in household infected humans, infected owners were probably able to transmit H1N1 infection to their own cats. And in both cases, cats can develop a fatal disease, and that's why we are concerned. The ABCD guidelines will guide the practitioner how to suspect a case of feline influenza in his or her daily practice. That is very important. And then after this suspicion, how to deal with the sampling, how to diagnose and to send correct samples to the diagnostic laboratories. Probably most important is also to prevent any infection of the practitioner himself, but also the assistants, and so also how to prevent the transmission of the infection in the household. So you can find all these elements, very practical elements, in these ABCD guidelines.